Hello, my friends. I'm Dr. Anna Collins, and today I want to talk with you calmly and clearly about this topic because many people live with it quietly every day, not realizing how much it can affect their comfort, their energy, and the way they move through life. I want you to imagine for a moment that we are sitting together in a quiet exam room. There is no rush, no alarms, no scary headlines. Just you and me having an honest, gentle conversation about medications, aging, and the heart. This is not about fear. It is about understanding your body a little better so you can feel more confident and supported in your everyday life. Many adults reach a point where daily aches, blood pressure changes, heartburn, sleep problems, or long-standing conditions lead to medications becoming part of the routine. You may take a pill in the morning without thinking much about it. You may trust, reasonably, that if something was prescribed, it was done with care. And most of the time, medications truly are helpful and appropriate. They relieve discomfort. They allow people to move, rest, and live more comfortably. But what many people are not told clearly enough is that as we age, the body responds differently. The heart, in particular, becomes more sensitive to certain stresses. This does not mean something is wrong with you. It simply means the heart has been working faithfully for decades. It has adapted to pregnancies, stress, illness, joy, grief, and daily life. Over time, it has less extra capacity than it once did. That is normal aging. Because of this, some medications that are well tolerated earlier in life may feel different later on. Not dangerous for everyone, not harmful in all cases, but potentially more demanding on the heart in ways that are quiet and gradual. This is important to understand because quiet changes are easy to miss. Many people tell me they did not notice anything dramatic at first. They just felt a little more tired, a little more short of breath walking uphill, a little more uncomfortable lying flat at night. These changes are often brushed off as age, stress, poor sleep, or simply having a busy life. And sometimes that is exactly what they are. But sometimes they are signals that the heart is working harder than it needs to. The heart is an incredibly patient organ. It compensates, it adjusts, it tries its best to keep you feeling normal. That is why changes can go unnoticed for a long time. This is not meant to frighten you. It is meant to remind you to listen kindly to your body rather than ignoring it or blaming yourself. One area where this matters is pain management. Joint pain, especially in the knees, hips, hands, and back, is extremely common after 40 and even more common after 60. Pain can limit movement, independence, and joy. Many people rely on medications to make daily life easier, and for many, these medications do help reduce discomfort. However, some pain-relieving medicines can also cause the body to hold on to fluid or slightly raise blood pressure. For a younger heart with plenty of reserve, this may not be noticeable. For an older heart, it can mean a bit more work with every beat. Over months and years, that extra effort can lead to fatigue, swelling, or breathing discomfort in some individuals. This does not mean pain should be ignored. It means pain deserves a thoughtful approach. Gentle movement, physical therapy, topical treatments, supportive footwear, pacing activity, and weight-bearing exercises often help the body feel more comfortable without placing extra demand on the heart. Many people find that combining smaller changes works better than relying on one solution alone. Another common area is blood pressure management. Blood pressure naturally changes with age, stress, and health conditions. Managing it is important, but it is also important to tailor treatment to the individual. Some medications work by relaxing blood vessels. Others affect heart rhythm or muscle contraction. In certain people, especially older adults, some options may feel heavier on the heart over time. This is why regular follow-up matters. Not because something bad is expected, but because bodies change. What worked well 5 years ago may need adjustment today. A gentle conversation with your doctor about how you feel, not just what the numbers show, can be very helpful. Heartburn and digestion issues are another quiet part of daily life for many adults. Acid reflux can disrupt sleep, appetite, and comfort. Medications that reduce stomach acid can be very effective, especially for short periods. But long-term use can sometimes affect how the body absorbs minerals that help regulate heart rhythm and muscle function. Again, this does not mean these medications are wrong or unsafe for everyone. It means they should be reviewed from time to time. Simple habits such as smaller evening meals, avoiding lying down soon after eating, elevating the head of the bed, and identifying trigger foods often make a noticeable difference. Many people are surprised how much relief comes from these gentle changes. One of the most important things I want you to hear today is that none of this is about blame. Not yours, not your doctor's. Medicine is complex. Every choice involves balancing comfort, function, and risk. What matters most is ongoing communication. If you ever notice new fatigue, swelling in the legs, breathlessness, dizziness, or changes in sleep, those are not things to ignore quietly. They are invitations to talk. Often, small adjustments bring relief and reassurance. It is also important to remember that medications affect people differently. Two people can take the same pill for years and have completely different experiences. Genetics, kidney function, heart reserve, hydration, and other medications all play a role. This is why personalized care matters so much. One gentle routine that often helps support heart comfort is daily movement that feels pleasant, not punishing. A slow walk, light stretching, chair exercises, or water movement all encourage circulation without strain. The goal is not fitness perfection. The goal is keeping the body engaged and comfortable. Another supportive habit is paying attention to fluid balance. Drinking enough water throughout the day helps the heart pump efficiently. At the same time, watching excessive salt intake can reduce unnecessary fluid retention. This is not about strict diets. It is about awareness and moderation. Sleep is another quiet partner in heart health. Poor sleep increases stress hormones and makes the heart work harder. Creating a calming bedtime routine, keeping lights low in the evening, and addressing nighttime discomfort can make a meaningful difference. Emotional stress also affects the heart. Caregiving, loneliness, grief, and anxiety are common, especially later in life. The heart does not separate emotional stress from physical stress. Gentle support, social connection, and self-compassion are just as important as medications. If you are taking several medications, one of the kindest things you can do for yourself is to periodically review them with your doctor or pharmacist. Simply asking whether each one is still needed at the same dose is a healthy and responsible step. This is not questioning authority. It is participating in your care. Never stop a medication suddenly on your own. Some medicines require careful adjustment. What matters is conversation, not abrupt change. I want to pause here and speak directly to you. If you have ever felt overwhelmed by medical information, confused by conflicting advice, or worried about making the wrong decision, you are not alone. Many people feel this way. You are doing your best with the information you have. Your body has carried you through a lifetime. It deserves patience and respect. Small, thoughtful choices add up over time. As we come closer to the end of our time together today, I want you to feel reassured, not anxious. Awareness is empowering. Gentle curiosity about how your body responds is a form of care. If this conversation helped you feel more informed or more at ease, I invite you to gently like this video. It helps me continue creating calm, supportive health guidance for you. You may also consider subscribing to the channel so we can keep having these quiet conversations together. And if there is someone in your life who might benefit from hearing this, someone you care about, sharing the video can be a simple act of kindness. I would also love to hear from you in the comments. You are welcome to share your experience, your questions, or simply say hello. This is a safe and respectful space. Thank you for spending this time with me. Take a slow breath. Be kind to yourself. And remember, you do not have to navigate your health alone.